I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today's video is about the effects of testosterone. If you are hoping to masculinize your body through the use of testosterone, here's a little bit of background information. Testosterone is produced in the testicles in people who are assigned male at birth. It is also produced to a lesser extent in the adrenal glands that are found in both assigned males and assigned females. What is a hormone anyway? Well, basically, a hormone is a substance that's produced by a gland somewhere in the body, and it travels, usually through the bloodstream, to another gland or an organ in the body to trigger a desired effect. Now think of a hormone as a messenger from one part of the body to another. A major function of testosterone is, of course, reproduction, because with the help of FSH and LH, the testicles make testosterone and also produce sperm. Testosterone has many effects throughout the body, and here's some of the things that my clients will notice when they start on testosterone. So the first thing that I usually see is that the voice begins to deepen, and this usually happens within about the first 2 or 3 months. If you're a vocalist, remember that your singing voice will also shift down, and this is something that you may want to know about. There are some little monitors that you can buy. There's one called Tuna Pitch, for example, and other things that are available on the internet if you want to actually see where your vocal pitch is going. Secondly, body odor may change. People tell me they smell like guys. And then thirdly, the menstrual periods will usually stop within the first 3 to 6 months on testosterone, but this is really variable. So here are a couple of important words about menstrual periods and testosterone. If you take testosterone but you forget it or you run out of it, you could have a period start. And it's even possible that you could become pregnant, although it's not likely. But if you did have symptoms of pregnancy, such as unusual fatigue, breast tenderness, urinary frequency, for example, get yourself tested for pregnancy so that you know and you have options available to you. Testosterone does not protect you from STDs or STIs, so remember that you should use another form of protection to keep you from getting one. PrEP is the wonderful medication that protects people from getting HIV. More changes that come with testosterone. Your libido or sexual appetite will probably increase. You may notice genital dryness, and sometimes we'll find that the Pap test, which is taken on anybody with a cervix, will come back unsatisfactory, and we may have to repeat these. And I believe that this is the effect of both dryness and the direct effect of testosterone on the cervix. Your clitoris will enlarge, and sometimes it can be enough so that the clitoris begins to look like a small penis. This is actually the basis of the surgery that people call metoidioplasty, and we'll probably be talking about this in another video. Okay, still more testosterone changes. You will likely have an increase in appetite, and it's not uncommon for people to gain some weight. Now, generally, it's not beyond 5 or 10 pounds, but it certainly can happen. You are also likely to develop skeletal muscle if you're working out, particularly if you're doing strength training to build muscle. Remember that muscle also takes more calories just to live on your body, so it may offset this appetite gain that people will have. We are told to look out for mood changes. People talk about testosterone rage, but we really never see it. And in fact, I find that people just feel better on testosterone. Now, there are more changes. This is the final slide. We find that the skin and hair has some important effects. You may get acne. This may be your second round with acne, but it's the combination of testosterone making more skin oil and then also combining that with bacteria on your skin to create acne again in the face, the neck, the shoulders, and the back. And there are medications that can help with this. If it's a problem, it usually tones down over time. Body hair increases. People tell me about the happy trail where there's new hair that develops from the pubic area up to the belly button. Well, one of my clients told me that there's also an unhappy trail that develops around the butt crack and north. You may lose scalp hair, and you may even start to bald on testosterone. If this is a problem for you and you don't like this effect, talk to your healthcare provider sooner than later. We have medications that can help to prevent this, and of course there are hair transplants available if a person were to need that. I hope this information was useful for you. If it was helpful, please like this video, share it with people who need it, and please subscribe to my channel. Thanks for watching today, and I'll see you in the next video.